as was just stated, I'm a gastroenterologist, and I think one of the things that's really motivated me in the last decade or so has been this appearance in my clinic of really remarkable rise in cases of colorectal cancer that occur in young adults. And when I first trained in gastroenterology, it was very, very unusual to see someone younger than 50 with colorectal cancer. And now it's actually become quite routine. So with that, I think we're really wanting to try to figure out and understand what's underscoring this trend, with the idea that trying to understand risk factors and trying to understand risk factors that might be causal will help us lead to some opportunities for prevention. So I think has been mentioned before, and Omar mentioned this in his talk, there is this rising incidence of early onset colorectal cancer. Many of you may be aware of this, but just to put this into a graphical portrayal, these are data which have really demonstrated that over the last several decades, there has been this really marked increase in cancer rates in both men and women younger than 50. And in particular, what's been very clear about this trend is that it's a birth cohort effect, meaning people who are born after 1950 in particular are at substantially increased risk of developing colorectal cancer over their lifetime as compared to individuals that were born earlier than 1950. And so it's become not just really an age issue, but it's really become a birth cohort effect, that the groups of people that have been born in successive decades since the 1950s are seeing this gradual increase in colon and rectal cancer, which really suggests that there's something changing in our environment over the past several decades. So I've been working in the field of colorectal cancer epidemiology for the last couple of decades, and one of the real resources that we've taken advantage of are the cohorts that Dr. Willett had mentioned earlier this morning, which have really been cohorts based at the Harvard School of Public Health and at Harvard Medical School that have been able to capture data from men and women that have been followed for several decades of life and have given us very detailed information on their lifestyle and diet, and also have been offering us their information as to whether they've been diagnosed with either colorectal cancer or colorectal polyps. And with this evidence base, we've actually found that there have been quite a lot of associations that we can draw from these data that might help to give us some early clues as to what might be underlying early onset colorectal cancer. So these are data that we've generated in both these Harvard cohorts as well as in other data sets. And it's been work led by my group as well as Dr. Yin Cao, who was a postdoc in my group and now leads her own group at Washington University. And this is a summary slide which just illustrates, I think, what we know about established risk factors for early onset colorectal cancer. And some of these risk factors are risk factors that we've discussed already in detail at this meeting with respect to colorectal cancer more broadly, but also other cancer types. And that includes obesity, metabolic comorbid conditions, diabetes. In addition, we've identified, for example, metabolic-associated fatty liver disease is linked with early onset colorectal cancer, sedentary behavior, aspects of alcohol intake, in particular drinking patterns. We've noticed, for example, that binge drinking without meals is associated with a higher risk of early onset disease, as well as other risk factors, including poor diet quality, sugar-sweetened beverages, evidence coming from microbial diets or diets that seem to be characterized by an overabundance of subflora microbial species, as well as low vitamin D. And so these have given us some early clues as to what are potential risk factors. Ultimately, the goal is to develop this understanding of associations into really causal understanding, because once we identify true causes, then we can reverse them and really start to identify what we can do in the near term to really prevent colorectal cancer in younger generations. So with that in mind, as has been mentioned, I've been privileged to co-lead this Cancer Grand Challenges team with Dr. Cao, which is entitled Team Prospect, which is Pathways, Risk Factors, and Molecules to Prevent Early Onset Colon Tumors. And so what I'll do today is really describe some of the work we've done in this area, again with that eye toward preventive interventions, really trying to get into the near term into some actionable insights that can actually lead us to reverse these troubling statistics in early onset cancer. This is our team. It's a multidisciplinary team that really represents leaders in various aspects of biology, public health, basic science, translational science, clinical trials, microbiome science, chemistry, and really brings together lots of different minds to think about this very difficult problem. And I think the real goal here is that we need to have very diverse perspectives to really attack what has been a fundamental challenge in the field. In addition, as you can see here, the team represents people from all across the globe. And this has really been purposeful because we understand that the early onset colorectal cancer trend is not just an American US trend, but something that has been noticed across the globe, including in countries which have not historically seen very high rates of colorectal cancer, for example, India. So this has really been intentionally an international team with multidisciplinary expertise. So what I'd like to do today is, because of the time limitations, I can't go into detail about all the different things that we're working on in Team Prospect, but I do want to focus in on a particular area which I think is probably where I think we've made the most progress in terms of our understanding of a risk factor for early onset colorectal cancer that we actually think is probably causal, and really I think has opportunities for preventive interventions, and that's metabolic dysfunction and diet. And this is really central, obviously, to the theme of today's conference, but I think it's also been central to one of the areas of Team Prospect. So we really have started to really view early onset colorectal cancer as really shedding a light on the fact that colorectal cancer is really a life course disease. Although colorectal cancer rates rise as people age, and we certainly conceive of colorectal cancer as a disease of adults and older people, the risk factors for the disease really probably start much earlier, likely in early adulthood, probably in childhood, and maybe even earlier than that. So I think this idea that early onset colorectal cancer is a life course disease is something that I think has been central to the work that we're doing in Team Prospect. In addition, I think we also have been really cognizant of the fact that many of these risk factors that we've identified for early onset colorectal cancer really center around the metabolic disease axis. So associations with obesity, diabetes, sedentary lifestyle, diet, they all point to the sort of convergence of risk factors on metabolic dysfunction and diet, lifestyle, obesity. And in addition, there's obviously a great deal of work that's been done to really think about metabolic disease as also being a disease of life course. So when we think about early onset colorectal cancer, I think we're trying to think about it with the framework that this may be a metabolic disturbance that occurs at the earliest stages of life. This is actually a work that was summarized in a review that was led by Mengshi Du, who is an instructor in our group, but I think really hits at the fact that there is evidence that metabolic dysfunction at these different phases is really quite critical when we're thinking about risk factors and when we think about windows of susceptibility where we can actually start to intervene. So again, just to summarize, as Dr. Willett had mentioned, we have the privilege of being able to examine data that's been contributed by participants in these remarkable cohorts that have been led since the 1970s and 80s. And again, have this unique ability to give us insight into the life course, because they have been enrolled in our cohorts at a relatively young age, and also have given us some data over the time period of the study into some of their exposures earlier in life. In addition, the availability of biospecimens and other things that have been collected in these cohorts gives us the ability to really interrogate some of these underlying mechanisms for us to really understand what potentially could be causal about risk factors that we identify. So as has been mentioned, primarily the data I'm going to show you today are from these three cohorts. In particular, I want to highlight the second cohort, which is the Nurses' Health Study 2, which is a younger cohort of women that were enrolled in 1989 when they were between the ages of 25 and 42. And the reason why this cohort is particularly valuable is because this cohort of individuals, when they were enrolled, really represents a cross-section of the population in the US for which we were starting to see this rise in early onset colorectal cancer. So it's a real nice sample of the population that was beginning to experience this rise in cancer rates under the age of 50. And just to kind of illustrate this more clearly, it's again not just an age effect, it's definitely a birth cohort effect. So depending on the decade of life you were born, your risk of colon cancer may be substantially different. And in particular, from data that was culled from US cancer registries, you can see here that the inflection point really was in the 1950s. So before the 1950s, you saw in the US this declining incidence and mortality in colorectal cancer rates. But after 1950s, the rates of colon cancer started to rise. And in addition, the rates of colon cancer mortality have started to rise. And if you look at the different birth cohorts in the Nurses' Health Study 1 and 2, when you combine the two cohorts, you see a very similar trend with really incidence dropping in the women that were born in the birth cohorts before 1950, and then you start to see a rise in incidence in the women that were born after 1950. And this is work that was led by Michael Fuchs and Cindy Zong, who's here in the audience from our group. So they represent a really nice cohort to begin to interrogate this data. So some of our earliest studies used data from the Nurses' Health Study 2, in which we identified women who actually were diagnosed with colorectal cancer younger than 50. And in one of the initial studies we published, this was work led by Yin when she was still a postdoc, you can see that within the Nurses' Health Study 2, the women that were considered to be in the highest BMI category, or what's considered obese, those women over the BMI category of 30 had about a twofold higher incidence of early onset colon cancer, here defined as cancer younger than 50, compared to women in a normal BMI category. So this was one of the first studies to really illustrate that early onset colorectal cancer might be associated with obesity or adiposity as really determined earlier at a life stage in adulthood. As we started to shift the attention to earlier phases of life, we also asked the question, does adiposity at an earlier stage of life associate with early onset cancer? So within the same study, Yin also looked at data that we collected from the participants as to what their weight was at the age of 18. And so when you look at their body mass index at the age of 18, you also see that women in the highest BMI category at the age of 18 had about 1.6-fold higher incidence of early onset colorectal cancer compared to women in the lowest category. But again, those are initial clues that obesity, adiposity is associated. What about other aspects of exposure? And as we think about risk, we should start to think about time points even earlier than early adulthood. In particular, childhood, but also potentially even earlier, for example, in utero or when someone is an infant. So one of the strengths of our cohort, again, has been the remarkable ability of our participants to also participate in a variety of ancillary studies. So within the 3 cohorts, there was an ancillary study that was added to the cohorts in which the participants of the cohorts were actually asked to provide a survey to their mothers. And so the mothers gave us information about what their experiences were when they were pregnant with the participant, both in terms of their experiences when they were pregnant, but also what the participants were exposed to when they were children. And this mother's questionnaire was administered across the 3 cohorts. And a substantial number of participants, about 45,000 people across the 3 cohorts, gave us this information, so giving us some really interesting data on that very, very early time point. And there's various domains that are relevant to what may be risk factors, again, for cancer later in life. That includes, again, pregnancy-related data, but also pregnancy when someone was a child. And so this is work led by Mingyang Song in our group, as well as Fangyong Zhang, one of the graduate students. And in one of the earlier studies, one of the initial studies we've done, we've looked at whether gestational weight gain, or the amount of weight that someone gains during their pregnancy, actually predicts future colon cancer risk in the offspring. And interestingly, there is an association. So among the participants' mothers who gained the most weight during their pregnancy, in this case 14 kilos of weight over the time course of their pregnancy, there was about a 2-fold higher incidence of their participant or their child developing colorectal cancer as an adult, suggesting that there's something happening in utero that does potentially portend future cancer risk, and does suggest that maybe that metabolic milieu that someone's exposed to in utero might have an effect on cancer that develops several decades later. Similarly, we've been thinking about this in the context of childhood, and so that's where we really started to think about the potential that we can study maternal factors and childhood factors in relationship to aspects of metabolic dysfunction in children. Because if metabolic dysfunction in children may be some clues as to what might be underlying cancer risk down the road, given the association of metabolic dysfunction more broadly in colorectal cancer. In addition, because we do know that metabolic dysfunction and obesity arise from a variety of risk factors, it's been important for us to think about what is contributing to this metabolic dysfunction, what's contributing to this environment of metabolic disarray that could lead to future cancer risk, and that's where we start to look into diet. So as many of you know, there's been a substantial change in sort of our pattern of eating over the last several decades. And one of these areas that has gotten a lot of attention lately has been the rising rates of, or the rising amount of ultra-processed food intake over the last several decades. This is data from the NHANES study, which has been cited earlier, which really tracks behaviors in the US population over time. And in particular, when you look at children, you can see that the amount of ultra-processed food that children are eating over the last several years has really risen. And that's also risen across different racial ethnic groups, such that now it's estimated about 60 to 70% of food that we eat is considered to be ultra-processed. Of course, ultra-processed is sort of a kind of a difficult term, and there's been a lot of controversy about what exactly ultra-processed food is. But when we use sort of definitions like the NOVA classification, this is sort of the data that we see, that there is this really amazing trend in the intake of ultra-processed food over the last several years. And this, I think, mirrors the trends in early onset cancer. So we wanted to really think about, does this trend in dietary exposures over the last several decades also track with changes in metabolic dysregulation in children, and also does it potentially track with early onset colorectal cancer? So this was work led by Mengxi again in our GUTS cohort. This is an offspring cohort of the Nurses' Health Study 2 cohort, in which she showed that if you look over a time period about 4 to 5 years in children, that those children that had the greatest increase or had about a 10% increase in ultra-processed food did have a substantial increase in the change in their body mass index after about a 4 to 5 year period. So that's during childhood. In addition, we've looked at maternal ultra-processed food intake and the risk of having offspring that are overweight or obese. And this is work led by Yiqing Wang, who is a postdoc in my group and now is a faculty member, in which we looked at data on what mothers were eating while they were pregnant and looked at the women that were in the highest quintile of ultra-processed food and compared the women who were in the lowest quintile, and found that they had about a 1.3-fold higher risk. Their children had a 1.3-fold higher risk of being overweight or obese compared to the women in the lowest quintile. And similarly, the mothers who had the most ultra-processed food in utero had about a 1.35-fold higher incidence of obesity compared to the offspring, or the women in the lowest quintile. So what the mothers ate in terms of what they were exposing their offspring to in utero seems to also be important to childhood obesity and metabolic dysfunction, which could portend future cancer risk. Ultra-processed food intake has been linked to a variety of metabolic conditions in adulthood, and that's been very clear, and it's also been linked to some extent to colorectal cancer. So we also wanted to ask this in a more specific way within our Nurses' Health Study 2 cohort. So this was a study led by Chen Wang, a postdoc in our group, looking at the association of ultra-processed food intake in the Nurses' Health Study 2 and the risk of developing an early onset adenoma. An adenoma is a precancerous polyp, so it's a lesion that is considered to be a surrogate marker for future cancer risk. And what she found was that the women in the cohort that had the highest intake of ultra-processed food had a 1.5-fold higher risk of developing an adenoma or a precancerous polyp before the age of 50 compared to those in the lowest quintile. So why is that risk there? Well, I think we understand that the ultra-processed food may mediate its association through metabolic dysfunction, but also to get at a little bit more of a mechanistic understanding of what's happening, we've also wanted to link ultra-processed food with various inflammatory biomarkers that could be related to future cancer risk and also may be a better marker of metabolic dysfunction. In addition, we know that ultra-processed food as a sort of a grouping or as a category is difficult because there's a lot of variation between what we consider to be in the highest NOVA classification of ultra-processed food. Some of those foods may actually be less harmful than others depending on how you look at their composition. So we wanted to understand, is there a better way to classify ultra-processed food by its effect on inflammatory biomarkers or other metabolic parameters? And so Qi Zhao, who was a graduate student also in our group, looked at the association of ultra-processed foods in relationship to various inflammatory biomarkers that we know portend future risk of potential inflammatory diseases. These biomarkers include C-reactive protein, IL-6, and TNF. And you can see that there are specific components of total of ultra-processed foods are somewhat linked to increases in these biomarkers. But there are certain categories of these ultra-processed foods that are of particular concern, and those include beverages and diet sodas and sugar-sweetened beverages, and also meat products. In addition, there's some insulinemic biomarkers that are linked to ultra-processed food. So sugar-sweetened beverages, for example, mixed dishes, meat products have all been linked with various biomarkers that are linked with hyperinsulinemia. There's also metabolomic signatures of ultra-processed foods within a sub-cohort of the participants who gave us blood specimens where we did metabolomic profiling. You can see from the heat plot here that, again, if you look at ultra-processed food as a category here, as well as different components of ultra-processed food, that there are certain metabolic signatures that can be derived that are related to ultra-processed food intake that could be mediators of the association of ultra-processed food with metabolic dysfunction or cancer, or could be also used as risk markers. Similarly, we can see that there are pro-inflammatory metabolites that are linked with ultra-processed food. So again, you can see here beverages, diet soda, meat products are positively associated with a variety of sort of pro-inflammatory metabolites here. And in addition, if you look at anti-inflammatory metabolites, again, there's linkages between ultra-processed food and certain anti-inflammatory metabolites. So these are kind of getting at some of the potential mediators of these associations that can give us some a better mechanistic understanding of ultra-processed food and its association with metabolic disease and ultimately potentially early-onset colon cancer. And so what are these kind of key biological pathways? I think these are pathways that have been discussed a little bit during this meeting in various of the talks. We know, for example, obesity is linked to insulin resistance as well as type 2 diabetes. That may in turn be linked to a variety of pathways that could be linked to downstream risk of colorectal cancer, including inflammation, gut microbial dysbiosis, and also epigenetic changes, and that particularly might be a factor early in life or in utero. And these are all things that could still be underlying risk of late onset, but is certainly potentially important early onset disease and could just represent the sort of frame shift of an obesogenic environment in younger generations. So just looking briefly at insulin resistance, this is unpublished data. So as been mentioned before, we've also been using our data to identify, for example, dietary components that are linked with hyperinsulinemia. We've also developed something called a hyperinsulinemic lifestyle score, in which in a subset of individuals where we have measured C-peptide, we've looked at what are lifestyle factors that we can put into a regression model that associate with levels of C-peptide. And then we've used that model to predict what might be C-peptide levels in the broader cohort. And in work led by Chen and Mengxi, you can see that the women in the cohort that had the highest likelihood of having high levels of C-peptide or having a relative state of hyperinsulinemia had a 1.26-fold higher incidence of that early onset adenoma or in people younger than 50. And also, when you look at it by birth cohort, it seems to be a very clear birth cohort effect. That association with hyperinsulinemic lifestyle and higher risk of an early onset of an adenoma seems to be primarily experienced by the women that were born after 1950. Just very briefly, I do want to touch on this component of gut microbial dysbiosis, only to say that there have been some very tantalizing associations between changes in the gut microbiome and colorectal cancer at early ages. And so we've been thinking about this in the context of metabolic disease. Nicholas Sagata, who's one of the co-investigators on Team Prospect, has led the field in terms of being able to pull together lots of metagenomic data from cohorts and look to see what are sort of gut microbial species associations with colorectal cancer. And as you can see here, with a large number of metagenomic data sets, he's been able to develop a score, if you will, of species that have been specifically correlated with early onset or with colorectal cancer broadly and anti-correlated. And I think what's most remarkable is that there is, when you look at the species that are linked with colorectal cancer more broadly, there's substantial overlap between colorectal cancer microbiomes and also microbiomes associated with cardiometabolic disease. So suggesting that there again may be a convergent pathway between metabolic dysfunction and colon cancer. So then the last I just want to cover briefly, how do we think about advancing this information to preventive interventions? Well, I think there are definitely near-term opportunities. I think there's been a little bit of nihilism in the field of early onset cancer where a lot of people are kind of throwing up their hands saying we don't really know and so we really can't do anything about it. Or there's the other perspective, which is we just need to screen and screen and screen. But I think there's also opportunities for primary prevention that we can think about in the near term. So certainly because we know obesity is a risk factor for early onset colorectal cancer, I think we know that there are highly effective anti-obesity agents, the GLP agonists, for example. Inflammation is, again, a convergent pathway between metabolic disease and cancer risk. So we know there are anti-inflammatory drugs that have been linked very conclusively to lower cancer risk, certainly in clinical trials of patients with Lynch syndrome. So I think there are opportunities to study anti-inflammatory drugs on early onset disease. And then also with the gut microbiome associations, I think there's definitely an opportunity to think about dietary interventions. And these are things we're doing within Prospect. So at MGH, we have a trial that's currently enrolling patients called the Prospect MGH trial, which is a single-arm study of 20 patients that have a history of an early onset adenoma. And after they've had an adenoma, they're then put on an open label study of tirzepatide, a GLP-1 GIP agonist, for 6 months. And across this study, we're measuring various biomarkers that have been associated with both metabolic dysfunction, but also potentially cancer risk. And that includes tissue biomarkers that we're collecting at baseline and at 6 months using flexible sigmoidoscopy, as well as microbiome profiling. And then with respect to gut microbiome, based on some really intriguing data in animal models, it does look like there are particular fiber interventions that might suppress microbiomes that have been linked with cancer. And that includes, for example, specific species linked to cancer, such as Colobactin PKS positive E. coli. So to follow up this mouse data, there's some observational human data that suggests that there is an association between fiber and lower rates of gut inflammation, and potentially also if you have a low fiber diet, there's also a higher likelihood that you may have a gut microbiome that's overpopulated with E. coli that produce colobactin. So to address this and to really see whether these associations are causal, we've started a trial through Team Prospect in the UK called the Eat Fiber trial. And this is where if we provide a whole food intervention, which is consistent of a high amount of fiber as well as a wide variety of fiber from a wide variety of fiber sources, which also is low in ultra-processed food, this could lower biomarkers of early onset cancer. And this is a study that's enrolling as we speak right now in the UK. And this is just a schematic of the trial. And so finally, the last thing I want to say is because we think some of these risk factors may be things that occur early in life, I think we also have to think about what are the kinds of things we can do to intervene at earlier life. It's very difficult to imagine that we would recommend pharmacological interventions, but certainly we could recommend dietary interventions. And I think we do also have to think about this from a policy perspective. As many of you know, there have been some efforts made to think about trying to alter, for example, what children are eating in schools, and also the access of our children to various aspects of an unhealthy diet. So I think some of these are things that we could think about from a policy perspective, not simply as a direct intervention. So in summary, what I hope I've been able to share with you is that we believe early onset cancer requires a life course framework. Metabolic dysfunction, I think, is a primary risk factor, and across the life stages seems to be associated with early onset colorectal cancer. In particular, obesogenic diet seems to be a player, and there is this potential mediating effect of microbiome because there's very clear evidence that microbiome associations with early onset cancer overlap with metabolic dysfunction. And I think we can use some of this information to really try to develop preventive interventions in the near term, and that could take the form of either repurposed agents or dietary interventions, and some of these trials will hopefully yield some important information in the coming years. Thank you very much.